Did you know that just like humans, your furry friends can get arthritis too? In May is Canine Arthritis Awareness Month. This morning we welcome our friend Tiffany Burke from the Bay Area Animal Hospital to talk more about the importance of this topic. Good morning.
Good morning.
Good to see you again as always.
You also.
Well, first off, let's talk about the causes. What causes canine arthritis?
There are so many different causes, and it's different for each pet. It could be their body mass, their weight, perhaps an abnormal joint, an injury, being too active, previous surgical history. If your vet says your pet has hip dysplasia, elbow dysplasia, or maybe a luxating patella, where the kneecap moves around and around.
Okay, brought a little prop there.
Yes, this is a knee, or a stifle. A previous injury. There is a ligament that goes in and through the knee. If your dog's a runner, they could compromise their ACL or partially or fully tear that. So all of these different factors could all contribute to arthritis.
And can dogs get at any age, just out of curiosity? Because I know they age faster than humans do, but is there any age range, or does it matter?
Yes, most definitely. Well, our senior pet population is the most affected. Senior cats and dogs can get arthritis, and if your pet has a pretty major injury or surgical intervention needed, arthritis can set into place earlier. Or if you have a more fluffy furry friend, they're carrying more weight, perhaps arthritis can start early because it's a very inflammatory condition at the level of the joint. So keeping your pet at a very lean body mass can help that, and intervening early.
Well, with all that said, what are some of those signs to look out for?
That's great. Well, each pet displays different symptoms. So if you have a dog and you're on a walk and you're a regular walker, sometimes they're just lagging behind. They're not charging at the end of their leash, pulling you down the road. Perhaps if you walk 2 to 3 miles, they're getting more tired around mile 1 or 2. Or they're having a hard time rising from laying down.
Yeah, we're looking at this graphic that you gave us there. Some of the things that stand out: difficulty with stairs, feeling a little stiff. So, pay attention to that for sure.
Yes, and if they're just maybe a little bit more lethargic at home, maybe kitty cats that are used to jumping up and down off of counters or couches, if they're being less active at home or not chasing that laser pointer around as much, that could be an early sign too for your kitties.
Okay, let's talk about treatment then. How should it be treated?
So it's not curable, it's very much treatable, and it's a multimodal approach. Typically we start with joint supplements like Cosequin or Phycox chews. These chews are designed to support the cells in the joint to make them nice and lubricated. And then keeping them at a nice lean body mass with a weight and mobility diet. We also use anti-inflammatories, NSAIDs, or non-steroidal anti-inflammatory drugs. Rimadyl, Galliprant are typically one of the first ones we choose. And now on the market are monoclonal antibody therapies. Fancy words for a once-a-month injection for your cat and dog. Librela is for dogs and Solensia is for kitties. This reduces something called cytokines or inflammation in the joint, bypasses the gut, works just at the joint to keep them mobile and moving at home.
So it's localized. Really
localized.
Yeah.
Great word. Yeah, localized.
And then anything else you could be doing though to make your dog or pet more comfortable?
Yes, most definitely. So if you have a kitty or a puppy, nice fluffy bedding for them to lay on. If you have slippery hardwood floors, put some mats down so they're not slipping and sliding around your floor. A ramp to go in and out of your car, and good exercise. We don't want their muscles to become atrophied. We want them to still be moving around. Take them for their walks, keep them active, and always, if you have a question, call your vet. And at Bay Animal Hospital, we have a senior pet newsletter. So go to our website, bayanimalhospital.com, click the blog newsletter section, and it has a lot of helpful tips that we've discussed.
Listen, you always come with the great information and scientific at that. I was trying to keep up with all those words. And then bottom line, I know you said it's not curable, but is there anything you can do to prevent it?
Prevention, yes. So you want to make sure you give your pets ample growing time. We don't want them to grow too fast. We don't want those long bones to grow too fast. Keep them at lean body masses. If they're getting a little fluffy, maybe tailor back your table food treats. We don't recommend that at all. And don't overfeed, and keep them active with yourself. And with the weather getting nice, get out there. Go for a walk with your furry family member.
You're so kind with the word fluffy too.
I know.
We know what you're talking about. All right, thanks so much again, as always, Tiffany Burke from the Bay Area Animal Hospital with some great information. Good to see you.
You too.